Well, hello again, fellow investigative interviewers. Welcome to another episode of The Practitioner. Today, we're going to talk about trauma-informed interviewing, a term that should be more than the buzzword that it's become. It will be presented in more than one episode. A few years ago, about the time of the Me Too movement, I first started hearing about trauma-informed interviewing. It wasn't long before it seemed that everyone was developing courses and webinars to teach it. I researched them and came away with two observations. One was that most didn't offer more advice than be respectful to your witness while adhering to a strict linear process. And the other was that few were founded on scientific principles to the extent that, for instance, the cognitive interview was. We were seeing the birth of training that was based predominantly on sound bites and anecdote. I know of one method in particular that gained traction by saying it was scientifically supported, yet upon investigation, it was nothing more than the cognitive interview, which I'm not criticizing, but it had a few pseudoscientific ingredients tossed in for effect. The curriculum appeared to be based on the ability to teach to the masses who had little appreciation for the education required to be truly trauma-informed. The term trauma-informed had unfortunately become nothing more than a buzzword. It was as ubiquitous as just breathe. Then I noticed a change. A few scholars and educated practitioners realized that a version of the trauma-informed interview had in fact existed for decades, with its origins in child interview frameworks such as Stepwise, NICHD, and ABE, which is from the UK and stands for Achieving Best Evidence. Those who had been trained in child interviewing recognized that everything about the method, from planning and preparation to the end of the court process, must concern itself with the needs of the child. Child interview practitioners had, possibly due to an intrinsic urge to protect a child, conducted themselves in a purely victim-centric way, realizing that the survivor might have been traumatized by the act against them and could be harmed even further by the interview process. Child interviewers, due to their specialized training and education, were able to understand how real memory should present, as well as how it could be affected by trauma. The education in memory, conceptual comprehension, and human development was integral to the success of the interview and was necessary to prevent a one-size-fits-all application. You see, child interviewers had long ago established that their interview goals were to obtain information that is complete and reliable, and this is important, while causing no harm to the child. In the same way child interview models were based on a non-linear application, thereby resembling a framework more than a strict protocol, a trauma-informed interview should be a series of malleable, interchangeable phases and tactics to be inserted as and when needed. As with child interviews, it must be response-oriented, where the flow and direction are dependent upon the individual before you. Now, when I think about how the process works, I'm reminded of the first aid training I received for dealing with a choking person. The first thing we were taught to do was confirm if the patient was indeed choking by asking, can you talk? Can you breathe? And if they could, we held off on applying a form of assault known for a while as the Heimlich maneuver. Why? Because this procedure could actually shift the food to a place that did prevent breathing, thereby causing more harm than had we done nothing more than sat them down and waited for an ambulance to arrive. Yes, how we responded had to be based on the presentation of the choking person. Additionally, we learned that the way we performed a physical procedure was dependent on the age of the choking person. We did a modified version of the maneuver for children and infants, again to prevent causing more harm than good. Using simple language, using the same forces we would on an adult could break a child. Now, here are a few guidelines that reflect how flexible we should be when conducting a trauma-informed interview. A trauma-informed interview should not be used on everyone. If you don't have reason to believe your witness had been traumatized, a regular investigative interview would suffice. A trauma-informed interview may be used on anyone who has experienced trauma, including a suspect or respondent. The trauma does not have to have been caused by the incident being investigated. Be open to cultural or other traumatic experiences. Don't assume the crime type dictates the need for a trauma-informed approach. Even non-physical offenses, such as, for example, fraud, could traumatize a person. Although it might present differently, perhaps as shame, it might reflect the survivor's habit behavior following the survival mode caused by the offense. A trauma-informed interview is not done the same on everyone. It is not a linear approach. Use a framework of principles as and when needed. So, all of this means we must understand human memory and how trauma affects it. As with a child who may explain something differently than an adult might have, we must recognize differences in how the traumatized might present. Okay, that's all for this segment. In future episodes, we'll take a deeper dive into the effects of trauma and how it may present during the interview, as well as what we could do better to achieve our interview goals of obtaining complete and reliable information in a way that would not cause more harm to the interviewee. That's all. Cheers.